Many people with chronic kidney disease don't know they have it because kidney disease can be a very quiet condition, often without symptoms until kidney function is quite low. That's why monitoring your labs is so important, so you don't miss the opportunity to protect your kidneys. Today, we're going to make kidney disease stages easier to understand. Come on, let's take this journey together. Hi everyone, I'm Marty on the road in Seattle, along with my husband Michael, who makes these videos possible behind the scenes.
We're both retired nurses with many years of experience. This content is for general educational purposes only. If you find these videos helpful, please consider subscribing. Your support helps us continue creating this content, and we truly appreciate it. Let's get started. Today we're taking a journey through chronic kidney disease stages and learning how your lab results help map your kidney health. Think of your kidney health like a journey. Your labs are the map, your doctor and healthcare team are the navigators, helping you understand the results and guide you down the right road, all while keeping you informed along the way. Chronic kidney disease, or CKD, is a chronic condition that develops slowly over time and continues to deteriorate kidney function unless steps are taken to protect the kidneys. The most common causes of CKD is diabetes and high blood pressure. They account for over 70% of the cases of CKD. There are other reasons that cause kidney disease, and those will be discussed in more detail in a later video. CKD is diagnosed through a series of lab tests that demonstrate a gradual decline in kidney function over time. There's another type of kidney damage called acute kidney injury, or AKI. Causes can include severe dehydration, low blood pressure, sepsis, urinary tract obstruction, and sometimes certain medications. I'll be doing a future video that will cover more about medications. In many cases, if treated, kidney function can recover after an acute kidney injury. Similar to a cat that has 9 lives, the kidneys can recover after multiple insults, but given enough time and continued injury, may eventually cause them to fail, with the end result being chronic kidney disease. Chronic kidney disease, or CKD, is measured in 5 stages based on your estimated glomerular filtration rate, or eGFR. Your eGFR reflects how well your kidneys are filtering waste from your blood. As I read through the stages, they will be displayed on the screen and will also be available on our Kidney Education Roadtrip website, so you can review them at your own pace. Stage 1 shows normal or near normal function with possible early kidney damage. We often lose a small amount of kidney function as we age. However, if kidney function continues to decline over time, it may not be due to just aging alone and should be evaluated for possible kidney disease. Stage 2 reflects a mild decrease in kidney function. Stage 3 indicates a moderate decline and usually requires closer monitoring and referral to a kidney specialist. Also notice on the screen that stage 3 is divided into stage 3A and 3B because there can be an important difference between early and later stage 3 kidney disease interventions. Stage 4 represents a severe decrease in kidney function where planning and closer management become very important. Stage 5 is the most advanced stage, and once dialysis has started, it's sometimes called end-stage renal disease, or just ESRD. If hearing the words end stage sounds frightening, I also created a separate short video that talks more about what those words really mean and the treatment options that still exist. There'll be a link at the end of this video called End-Stage Kidney Disease Does Not Mean the End. At stage 5, your nephrologist will help determine the safest time to begin ongoing dialysis treatments or pursue a kidney transplant to help sustain life. In many cases, kidney function does not fully return once it has been severely reduced, especially when kidney function has remained very low over time. For people in earlier stages of chronic kidney disease, progression can often be slowed significantly, especially when kidney disease is detected early and managed carefully. This may include controlling blood pressure, managing blood sugar, staying appropriately hydrated, following dietary recommendations, and taking medications as prescribed. Also addressing lifestyle factors. Even with advanced kidney disease, many individuals continue to live full and meaningful lives, including those receiving dialysis treatments. I know information about kidney disease and dialysis can bring up many questions, and it's very common to have them. Please remember to write down any questions you might have and discuss them with your healthcare team. Let's talk about labs now. Kidney function is monitored through several key lab tests. Serum creatinine is one of the most common tests and helps measure waste buildup in the blood. Blood urea nitrogen, or BUN, is another marker that reflects waste products in the blood. Urine tests are also important and can check for protein or blood spillage, which may be signs of kidney stress or damage. Together, these labs help give a picture of overall kidney function. Serum creatinine is also used in a calculation that estimates your glomerular filtration rate, or eGFR, which helps determine your stage of chronic kidney disease. This eGFR calculation takes into account your age, your sex, and other clinical factors, which makes it a more complete estimation of kidney function than just using blood tests alone. Here's an example using the eGFR calculator from the National Kidney Foundation. I'll leave their link in the description below. For example, a serum creatinine of 2.1 in a 66-year-old female would result in an eGFR of about 26, which allows the doctor to classify the kidney stage. This would place the kidneys at a stage 4 CKD. If this same patient returns in about 3 months for a follow-up and her eGFR improves by a few points to, say, maybe 28, this may reflect a small improvement, or it could simply be normal variation in lab values or hydration status. This is why a single lab value is not usually interpreted alone, and why trends over time are so important. In some cases, another test called cystatin C may also be used either alone or alongside the serum creatinine to help estimate the GFR, although it's not used as commonly. Tracking these numbers over time helps you and your healthcare team understand whether the kidney function is staying stable, improving, or declining. Be sure to discuss these changes with your healthcare team so that the full picture can be understood. Many people benefit from seeing a kidney specialist, also known as a nephrologist, once the kidney function begins to decline, and should be added especially when the eGFR falls below 60 or about stage 3. A primary care provider helps guide overall health, while a nephrologist provides more specialized support for kidney care. They help interpret lab results, adjust medications to protect the kidney function. They also help recommend lifestyle and dietary strategies, and they can coordinate care with other providers. If you feel like you're not receiving enough guidance, it's okay to seek a second opinion, because having the right support team or navigators matters on this journey.
Most people with chronic kidney disease don't feel sick because kidney disease can progress very quietly over time. Symptoms often don't appear until kidney function is significantly reduced, and some people don't have any symptoms at all. That's why monitoring your lab tests are so important. Lab monitoring frequency depends on the stage of kidney disease. In stages 1 and 2, labs are often checked at least once a year, though your provider may recommend more frequent testing to keep an eye on it. In stage 3, labs are typically done every 3 to 6 months. In stage 4, monitoring often increases to about every 1 to 3 months. In stage 5, labs may be needed monthly or even more frequently, especially when preparing for dialysis. The most important takeaway from this video is that your eGFR is the key number to know. This number reflects your kidney function. It helps you to understand where you are on your kidney journey and what path to follow for the future. Even if you're told things are stable, knowing your actual eGFR number allows you to see your own trends and better understand what's happening. Understanding your numbers helps you take an active role in your care, stay aware of changes early, and take steps that may help protect kidney function for as long as possible. Now you understand what chronic kidney disease is, how it's staged, and why lab monitoring matters, and the important role of a kidney specialist or nephrologist. Think of your kidney health like a journey where understanding your results helps guide your path forward. Small, consistent changes can make a meaningful difference in slowing progression. In our next episode, we'll explore the causes of chronic kidney disease and the factors that affect kidney health, so you can better understand what to watch for and how to support your kidneys along the way. Thank you for joining us, and we'll see you in the next episode.